Sir, my problem is that I get recurrent attacks of giddiness which persist for 3 to 4 hours. Sir, these episodes of giddiness are followed by episodes of nausea and vomiting. Sir, I had my first attack of giddiness 8 years back, and now it is seen that I'm having attacks almost attack of giddiness almost every month, or it is even seen that I'm having 2 attacks per month. So all the tests have been conducted, including MRI of brain and spine, carotid, Doppler, ECG, eye testing. Nothing incriminating has been found in these reports. Sir, I have visited many doctors, including ENTs, neurologists, orthopedic surgeons, general physicians, and many renowned institutions like AIIMS, PGI Chandigarh, CMC, Vellore. Sir, I have visited almost all the specialities other than oncologist and gynecologist. I have even visited psychiatrist, sir.
What is the outcome?
Everybody has been held other than me. In my case, only the medical documents, prescriptions and bills have been amassed. My condition has worsened. I have been prescribed different sedatives and anti-vertigo drugs. The choice of drugs have been hovering around normally Vertin, Stemetil or Stugeron, sometimes 1, sometimes 2, or in cases even 3.
So why are you here?
Just read from the net that a neuro-otologist is a specialized doctor to treat vertigo patients. Inquired at different places regarding neuro-otologist. Many doctors had referred me to a neurologist instead of a neuro-otologist. So Google searched and landed up at your clinics.
Can I see your medical reports?
Sir, all reports are normal and the medicines are the ones which I have told you. Some younger doctors, the over-enthusiastic ones, they have prescribed me Diamox and Ditide, but the former did not suited me because I had an electrolyte imbalance. So from CMC Vellore, after a lot of tests, I was prescribed the Vertin and Ditide and was asked to continue for 3 months, and after that, as and when required, the episodes of giddiness reduced, but not to my satisfaction. I developed a deep fear lurking inside me regarding an impending attack of vertigo followed by vomiting, and this was really embarrassing for me in front of my co-associates in my office. For this reason, I had taken a medical leave of 4 months. This is very much frustrating as it has completely jeopardized my life. It is better to die than to live in this fear of impending attack of giddiness.
In between 2 attacks of giddiness, are you otherwise normal? That means in between 2 attacks, is there any unsteadiness or any small attacks of giddiness, or you are perfectly normal in between 2 attacks?
Other than the buzzing sound in the ear and deafness in the left side of the ear, I don't have any other problem.
Oh, you never told me about the buzzing sound and the deafness.
You never asked me.
During the attacks of giddiness, is there any headache or is there any intolerance to light or sound? That means that does any light or sound irritate you very much during the attacks, when you are getting the attacks of giddiness?
Not really. I do not have any headache during episodes of giddiness, but yes, definitely I have severe throbbing headache on one side of the head and a definite intolerance to light and sound.
Okay. What other symptoms do you have during the attacks of giddiness? Any double vision, any weakness of the limbs, or anything that you can tell me that happens during the giddiness other than, say, some amount of nausea and vomiting?
Many doctors have asked me whether my deafness or buzzing sound aggravates during the episodes of headache, but I have not really felt so. The deafness and gidding sound may not be related to my headache, as I had deafness in my ear a couple of years before the giddiness started.